Low fat or low carb? I know a lot of people feel strongly on one way or the other about this, but what does science have to say about this? There's no question that diet plays a critical role in our health and how healthy we can possibly be, improving our health, etc. But it seems like every other week there's a new study coming out, more research coming out showing the benefits of either a low fat diet or a low carb diet. So, how do you know what you should be following? Do you know? What diet is going to be best for you? Hi, my name is Dr. Terranella, and in my practice, I spend a significant amount of time guiding and counseling my patients on what foods and what diet can most help them reach their health goals, whether they have high cholesterol, high blood pressure, diabetes, want to lose weight, improve digestion, improve their energy. Pretty much you name it, there's a dietary intervention that can be done to improve your health most of the time. In this video, we're going to look at the role of two macronutrients, carbohydrates and fat, and attempt to answer the question, which is better, low fat or low carb, for weight loss and general health outcomes. To answer this question, we're going to look at the role these macronutrients play in weight loss and general health, also known as all-cause mortality. There's no dispute about the role excess body weight has on disease outcomes and the subsequent reduction in life expectancy when you have excess body weight. For instance, cardiovascular disease is the leading cause of mortality worldwide, and excess body weight is one of the major risk factors for cardiovascular disease. So to simplify, we'll use body weight or weight loss as a predictor also as to which diet is going to be best for you. So we're looking at mainly weight loss and using weight loss as a predictor for all-cause mortality. So let's look at how we can manipulate these two macronutrients for the most weight loss. Of course, which diet is best for you, low fat or low carb, in terms of achieving weight loss or reducing all-cause mortality, is definitely an area of hot debate right now. And I'm not going to attempt to resolve that debate here today, but what I do want to do is point to some research that may help steer you in the right direction in terms of which diet might benefit you the most. Of course, we know that weight gain results from a positive net balance. So you're consuming more calories than what your body is requiring. And this excess body weight is these excess calories are then converted into fat. And traditionally speaking, it's thought that lower fat diets are better because fat is basically more calorically dense than carbohydrates. So the difference is 1 gram of fat equals 9 calories, and 1 gram of carbohydrate equals 4 calories. So nowadays, this wisdom is sort of being called into question. So, for instance, several studies have shown that reducing carbohydrates beyond a certain threshold in your diet actually leads to an increase in fat metabolism and breakdown, even when calories are kept constant or the same. Fat breakdown is known as beta oxidation, and this does typically translate into weight loss, specifically fat loss from your body. However, not all research shows a higher weight loss in those following a low carbohydrate diet compared to low fat diet. In fact, a recent study looking at non-diabetic obese individuals found that they lost more weight following a low fat diet versus a low carb diet. So what's going on here? It appears that the common denominator is the efficiency of glucose metabolism, aka carbs. And one study showed that the ability of overweight individuals to lose weight on any given diet could be predicted by their ability to metabolize carbohydrates. So if you have normal glucose metabolism, aka carbohydrate metabolism, a low-fat diet would likely be better for you. If you don't have normal glucose metabolism, like diabetes or metabolic syndrome, prediabetes, these types of things, you may likely lose more weight on a lower carbohydrate, higher fat diet. What's also interesting is that some people are more challenged when it comes to metabolizing certain types of fat for genetic reasons. And I think if this were taken into account in the above studies, the lower carb result may have even been more pronounced. And another important factor to note is how we define normal glucose metabolism. Um, and I think it's best to sort of look at what abnormal is. So typically, abnormal glucose metabolism will show up on blood work with an elevated fasting glucose, elevated hemoglobin A1C, elevated fasting insulin. There are other tests that may help us look at this too. Insulin's usually the first thing to show up elevated, and I usually consider anything above 10 suggesting that there may be a problem. Using all these numbers together plus other numbers can help us really get an accurate picture of what's going on in your body as far as glucose metabolism, potentially why you're having difficulty losing weight. Low fat or low carb, what about cardiovascular and all-cause mortality? So we talked about low fat versus low carb for weight loss, and it seems like the lower carbohydrate wins based on your glucose metabolism. And generally speaking, when you look at traditional risk factors for cardiovascular disease like cholesterol and cholesterol subfractionations, a lower carbohydrate diet typically beats out a higher carbohydrate diet in terms of lowering the risk profile. Specifically, it'll lower your LDL, your bad cholesterol, and raise your HDL, your good cholesterol. However, one study recently compared plant-based low-carbohydrate diet with animal-based low-carbohydrate diet. And the plant-based lower carbohydrate diet was superior to the animal-based lower carbohydrate diet in terms of all-cause mortality and cardiovascular disease and cardiovascular mortality. So this likely stems from the fact that most people that do lower their carbohydrates often increase their protein. And by doing that, you're potentially increasing your risk for other things. It also takes you out of ketosis, which is probably one of the most beneficial aspects of being on a low carbohydrate diet to begin with. So if you're not getting your protein level low enough and your carbs are still high, you may be not getting quite as much benefit as you think. This is much more difficult to do when you're eating a plant-based diet or vegetarian diet because oftentimes the carbohydrates and protein are linked. So if you increase your protein, you're also increasing your carbohydrates. Whereas if you are very specific about lowering your carbohydrates, you're also going to lower your protein, unless you're consuming copious amounts of protein powder. But usually they'll shift more to nuts and seeds, which are higher in fat. And so it looks like that may be what's going on. That's my interpretation. So in summary, it looks like low carb wins out in terms of weight loss and cardiovascular risk, but you have to be careful. Number one, you want to make sure you're using this only if you have glucose metabolism issues. If you don't, then I would say be careful not to increase your protein too much because you may be increasing your cardiovascular risk. To learn more about different ratios for diet modification of macronutrients, you can look at another video that I did on ketogenic diet, Macronutrients Explained. That's the title of it. Hey, I hope this video was useful and helping you think about and decide which macronutrients to put in your diet. Low fat, low carb. Hopefully you have a better understanding of what you should be looking at there. If this video was useful for you, please click on the like button because this helps me to decide which types of content you're most interested in. The more likes, the more I will shift the videos towards that type of information. Please keep in mind that this video was not an exhaustive look at all the debates on high fat versus high carbs or low fat or low carb diets. The debate's still ongoing. There's still lots of research, and I just tried to present what I thought was most pertinent for you to help you decide for yourself. If this type of information is interesting to you, if you like this type of information, please subscribe to the channel. I will be posting more information on different diet and health tips very soon. We'll see you next time.